Pulmonary disorders are a major global health issue. Understanding acid-base balance and interpreting arterial blood gas, ABG, analysis is crucial for diagnosing and managing respiratory conditions. This video covers ABG basics, sampling techniques, oxygenation, compensation, mixed disorders, and ABG analysis in specific conditions and critically ill patients. Oxygen therapy and neonatal considerations are also discussed. Maintaining acid-base balance is crucial for optimal physiological function. This topic will delve into the fundamental concepts and mechanisms involved in acid-base regulation within the body. We will examine the role of respiratory and renal systems in maintaining acid-base homeostasis, the influence of carbon dioxide and bicarbonate on pH levels, and the physiological buffers that play a role in maintaining the balance between acids and bases. Accurate ABG sampling is essential to obtain reliable results for clinical decision-making. This topic will explain the various techniques involved in arterial blood gas sampling, including the choice of arterial puncture site, sample handling, and potential sources of error. Furthermore, we will discuss the interpretation of ABG values, including pH, partial pressure of oxygen, PaO2, partial pressure of carbon dioxide, PaCO2, bicarbonate, HCO3, and the calculation of base excess. Differentiating between respiratory and metabolic acid-base disturbances will also be discussed. Assessing oxygenation status is a crucial aspect of managing patients with respiratory disorders. This topic will explore the parameters used to evaluate oxygenation, including arterial oxygen saturation, SaO2, oxygen content, CaO2, and oxygen delivery, DO2. We will discuss the significance of pulse oximetry, central venous oxygen saturation, SCVO2, and mixed venous oxygen saturation, SVO2, in assessing tissue oxygenation. Additionally, the role of oxygen dissociation curve, shunt fraction, and ventilation perfusion mismatch in oxygenation assessment will be elucidated. Assessing ventilation effectiveness provides crucial information about respiratory function. This topic will delve into the evaluation of ventilation through parameters such as minute ventilation, alveolar ventilation, and the alveolar arterial oxygen gradient, AA gradient. We will discuss the interpretation of these parameters in various respiratory conditions, including obstructive and restrictive lung diseases, as well as their relationship with ABG values. The body employs compensatory mechanisms to maintain acid-base balance when imbalances occur. This topic will explore the compensatory responses to respiratory and metabolic acidosis and alkalosis. The role of renal compensation, including alterations in bicarbonate reabsorption and hydrogen ion excretion, will be discussed. Furthermore, the limitations and time course of compensation in acid-base disorders will be elucidated. In clinical practice, patients often present with mixed acid-base disorders, posing diagnostic challenges. This topic will provide a detailed approach to interpreting ABG values in the context of mixed acid-base disorders. We will discuss the identification and differentiation of primary and compensatory acid-base disturbances, as well as the impact of additional disorders on the overall acid-base status. The anion gap is a valuable parameter in assessing the cause of metabolic acidosis. In this topic, we will explore the concept of anion gap and its clinical significance. We will discuss the calculation of anion gap, its normal range, and how deviations from the normal range can assist in the differential diagnosis of metabolic acidosis. Respiratory failure necessitates timely and accurate ABG analysis to guide appropriate management. This topic will focus on the interpretation of ABG values in respiratory failure, including acute respiratory distress syndrome, ARDS, chronic obstructive pulmonary disease, COPD, and pneumonia. We will discuss the role of oxygen supplementation, non-invasive ventilation, and mechanical ventilation in the management of respiratory failure based on ABG findings. Various medical conditions can predispose individuals to specific acid-base disturbances. This topic will explore acid-base disorders associated with conditions such as kidney disease, liver failure, diabetes mellitus, sepsis, and electrolyte abnormalities. We will discuss the underlying pathophysiological mechanisms, diagnostic considerations, and management strategies for these conditions. ABG analysis plays a vital role in the management of critically ill patients. This topic will delve into the application of ABG analysis in the intensive care unit, ICU, setting. We will discuss the interpretation of ABG values in severe sepsis, shock, acute respiratory distress syndrome, ARDS, and multi-organ dysfunction. Additionally, the use of ABG analysis in guiding fluid resuscitation, vasopressor support, and mechanical ventilation will be explored. Oxygen therapy is commonly employed in the management of respiratory disorders. This topic will focus on the evaluation and optimization of oxygen therapy based on ABG values. We will discuss target oxygen saturation ranges, titration of supplemental oxygen, and the potential risks associated with excessive oxygen administration. Considerations for patients with chronic respiratory conditions, such as COPD, will also be discussed. ABG analysis in neonates requires careful interpretation due to their unique physiology and developmental considerations. This topic will explore the specific considerations in ABG analysis for neonates, including normal reference ranges, the influence of fetal circulation, and the significance of oxygenation and ventilation parameters. We will discuss common respiratory disorders in neonates, such as respiratory distress syndrome, RDS, transient tachypnea of the newborn, TTN, and meconium aspiration syndrome, MAS, and how ABG analysis aids in the diagnosis and management of these conditions. Understanding acid-base balance and arterial blood gas analysis is vital in pulmonology and critical care. This video covered the concepts, techniques, interpretation, compensation, mixed disorders, anion gap, respiratory failure, specific conditions, oxygen therapy, and neonatal considerations for ABG analysis. Applying this knowledge enables accurate diagnoses and optimal patient management.